How are adult ADHD assessments done? If you are curious about how adult attention deficit hyperactivity disorder assessments are conducted, you are in the right place. Let's break down the process step by step. Adult ADHD assessments typically start with an initial screening. This is designed to see if symptoms of ADHD might be affecting areas like social life, work, or emotional well-being. During this screening, you might fill out questionnaires such as the Adult ADHD Self-Report Scale or the Conners Adult ADHD Rating Scale. These tools help identify patterns that may suggest ADHD. Once the screening is complete, a clinical interview takes place. This interview is usually conducted by a psychologist, psychiatrist, or a neurodevelopmental expert. It covers a wide range of topics. You will discuss your current symptoms, their history, and how they impact your daily life. Important details include when and where symptoms occur, how long they last, and whether they started in childhood. This is key because ADHD symptoms must be present from childhood and continue into adulthood for a proper diagnosis. The interview also looks into your academic and work history, relationships, and coping strategies. It is important to discuss any other conditions you may have, like anxiety or depression, as these can overlap with ADHD symptoms. A full diagnostic evaluation may also involve gathering information from people close to you, such as family members or partners. This is known as collateral history. Their input helps confirm if symptoms are consistent across different areas of your life, which is necessary for an accurate diagnosis. In addition to interviews, you may take some objective behavioral and cognitive tests. These tests assess attention, memory, impulse control, and executive functioning skills, which include planning and organization. One example is the continuous performance test, which measures how well you can maintain attention and control impulses. While these tests provide useful information, they are not enough on their own to diagnose ADHD. The assessment process follows guidelines from the Diagnostic and Statistical Manual of Mental Disorders, 5th edition. This manual states that symptoms must cause significant impairment and cannot be better explained by another mental health condition. A thorough review of your developmental history, medical background, family history, and psychosocial factors is also part of the assessment. Typically, the entire assessment can take at least 2 hours. This time allows for a detailed exploration of your symptoms and their impact on your life. Since there are no biological tests or brain scans that can definitively diagnose ADHD, the best approach remains a careful clinical evaluation supported by multiple sources of information. The practical side of this assessment process includes identifying your strengths and coping strategies, as well as challenges. This information can help guide personalized treatment plans. Understanding the full context of your symptoms helps clinicians recommend the best interventions, whether they are behavioral therapies, coaching, medication, or a combination of these. This thorough assessment acknowledges that ADHD symptoms can last a lifetime. It is important to consider your unique experiences and environments. Remember, the diagnosis is not based on a single test but on a comprehensive understanding of how ADHD affects your functioning over time and across different settings.